Assalamu alaikum. My name is Kuratulan and my roll number is PP1650176. And the topic drug which I am presenting here is factor 8 concentrate drug. Now the factor 8 concentrate drug. So before understanding the case which I am going to tell over here, I would like to highlight some information regarding the drug. So the drug information including in 1992 the US Food and Drug Administration approved the recombinant factor 8 concentrate which doesn't come from human plasma. Now this concentrate is genetically now prepared and it is designed by using the DNA technology. This commercially prepared factor concentrate they are used to remove or inactive blood-borne viruses. Now, irrational use of the drug. The factor 8 is a medication which is used to treat and prevent the bleeding in the people with hemophilia A and other causes of low factor 8. This hemophilia it is a genetic disorder which is cause increase in bleeding disorder with poor prognosis if condition is not recognized and is more common in adult patient and it is also more common in elderly male as compared to the female. Main side effects flushing of the face, headache, nausea, and fast heartbeat may sometimes occur, but it can be lessened by giving the medication more slowly. Other side effects include burning, redness, irritation at the injection site, fever, chills, and may also occur. Dose variation. Now, the doses of the factor 8 concentrate they are calculated according to the severity and location of bleeding. As a rule, factor 8 1 unit per kg increases factor 8 plasma level by 2%. Dose depend upon the type of bleeding, either it is severe or not, and where it is located, the type of location. On the basis of these two things, the dose vary among the patients. Like in this case, it is there is a chart I have describe the indication and type of bleeding and its mean initial dose units per kg body weight. For example, if there is a bleeding into joints and muscles, then in initial dose is required 20 to 40 unit per kg according to the body weight of patient. If there is a life-threatening bleeding, 50 to 80 initial dose is required. Similarly, if there is bleeding to the soft tissues or there is the bleeding in the urogenital bleeding, then the dose vary. Like there is if there is surgery, major wounds or high tendency of the bleeding, we required more initial dose like 50 to 80 units per kg of the body weight. According to the severity, the dose vary, and according to the type of location where it is located, the dose vary among the patients. Dose adjustment. There is a formula by which the factor 8 concentrate dose is adjusted among the patients depending upon their body weight and their severity of the disease, and how much according to the severity of disease how much factor 8 concentrate level is required. It can be calculated according to the formula. The formula include weight divided by 4.4 into factor level desired is equal to number of factor 8 units needed. Now among pediatric geriatrics and renal compromised patients it vary. Factor 8 level desired in case of pediatric 20 to 40 or 80 to 100%. In case of geriatric 10 to 20%. In case of renal compromise 10 to 50% is required. It also vary, either it is minor bleeding or it is major bleeding. So the dose vary. In case of minor bleeding, in case of pediatric 10 to 20 international units per kg of IV is required. In case of geriatrics 1.5 international unit. In case of renal compromise 5 to 10 international unit per kg IV is required. Similarly, in case of major bleeding the dose increases. In case of pediatric 40 to 50 international unit per kg is required. In case of geriatric 2.5 international unit per deciliter unit per kg is required, and in case of renal compromise 20 to 40 international unit per kg IV is required. Drug known to interact with factor 8. Where if we saw there is no such serious case or interactions found with factor 8, but there are some drugs that interact with the factor 8. This include carfilzomib, imsizumab, and pegvaliase. These three drugs interact with the factor 8 very rarely, and if it interact, it cause not serious interactions, very serious effect, because factor 8 usually do not cause any serious interactions with the drugs. Drug toxicity. Drug toxicity plasma derived factor 8. Previously, when we do not have any technology, this factor 8 was synthesized from the human plasma. This human plasma contains a presence of protein which is known as albumin protein, which is responsible to produce the toxic reactions. But in 1992, when the US Food and Drug Administration approved the recombinant factor 8 concentrate, which doesn't come from human plasma, because this concentrate is genetically engineered using the DNA technology. Now, this factor 8 concentrate are treated to improve or inactivate these blood-borne viruses. So, previously, the plasma-derived factor 8 produces the drug toxicity, but as we design it genetically by using the DNA technology, this plasma protein this factor 8 do not contain this plasma protein or albumin, so that's why cannot spread any bloodborne viruses. Now, drug alternatives. Sometimes we need alternative of our drug, because sometimes our drug is most costly, we cannot patient cannot afford it. Sometimes the half life of the drug is very short, so we need frequent intravenous injection. In order to avoid such problems, we need drug alternatives. So in case of factor 8 recombinant products, we have different drug alternatives that can be used. Hemlibra works by replacing the function of factor 8 rather than replacing the missing clotting factor 8 directly. DDAVP or estimate, which is known as desmopressin acetate, its trade price is also very less, that is 1700. And estimate, these are the medications that are similar to hormone that occurs naturally in our body, but this medication release factor 8 from where it is stored in the body tissues. So for people with mild as well as some cases of moderate hemophilia, this can work to increase the person's own factor 8 levels, so they do not have to use clotting factors to stop bleeding episode. We have F-Styla, that is trade price is 1732, has increased stability and extending half-life. Dosage form. Factor 8 is delivered usually by intravenous infusion. So mostly factor 8 is given by IV route, but some other forms are also available. In case of mild conditions, we can also use nasal sprays, tablet dosage form of some products to treat this bleeding disorder. Available drug products. There are two types of the drug products which are available in the market, that is plasma derived products and recombinant products. These plasma derived products, they are derived from the human plasma, for example hemophil am. There is also recombinant products which are genetically engineered by using the DNA technology. In this we have different generations. First generation products, for example recombinant. Second generation products, for example helixate. Third generation products, for example Exintha. Fourth generation products, for example Nuvic. Third and fourth generation with EHL products, for example F-Styla, Elocate. Irrational use of the drug. There is no such irrational use of the drug is reported, so no data is available. Available brands of the drug. Now if we compare the quality and price comparison, there are different brands of factor 8 is available. Co8 DVI, Advait, Monoclate P, Hemophil M. Now if we look according to the price comparison, then Co8 DVI is very, as compared to the others, it is not much expensive, so that's why it is mostly used. Then we have Advait, and then we have Monoclate P, it is costly. Then more costly is Hemophil M. Now if we compare the quality of the product, then Advait, it is very less effective because it do not contain any preservatives, so that's why it is very rarely used. So most commonly used is Co8 because it is stable, purified, and it is dried concentrate, so that's why. And it is also cheap amount as compared to the other drug products, that's why it is used. Most commonly we use Co8 DVI. Then we have Monoclate P and Hemophil M. Among these two, Hemophil M, it is most stable because it is non-pyrogenic preparation and it is also a sterile one, so its quality of the product is increased much in case of Hemophil M as compared to Monoclate P, which is also a sterile product but it is non-pyrogenic, so that's why Hemophil M quality is best as compared to the Monoclate P. But Hemophil M is much costly, that's why we do not prefer to use Hemophil M. Now case study: a 59-year-old man having weight of 100 kg which is presented to emergency department with a 24-hour history of sudden and onset pain in his right groin and leg. The pain was so severe that it had prevented him from sleeping. Clinical examination revealed an impaired leg rise on the right due to pain and spontaneous soft tissue bleeding into the right thigh. He also had multiple comorbidities, including type 2 diabetes mellitus, hypertension. His medications include allopurinol, humulin, aspirin, furosemide. MRI of the pelvis and right leg was performed and revealed a right iliac hematoma extended to the right abductor muscle, causing a hemoglobin drop from 103 to 84 gram per liter. APTT, activated partial thromboplastin time, was increased at 2.38, whose normal range is 0.8 to 1.2. Plasma factor rate was found to be lowest, that is 22 international unit per deciliter. Subjective, the weight of the patient is 100 kg, age is 59 years, gender is male, and history is type 2 diabetes mellitus, hypertension. Patient is suffering from these two type of diseases, for which he is taking the medications include allopurinol, humulin, aspirin, and furosemide. Objective, patient presented to emergency department with a 24-hour history of sudden onset pain in his right groin and leg. Preventive measures and treatment to reduce and soft tissue bleeding of right thigh. We need to do the treatment to keep APTT, which is 2.38, which is increased, and factor 8, which is 22 international unit per deciliter, which is lowest value, and hemoglobin, which also drops from 103 to 84 gram per liter. So we need to do the treatment to keep all these factors in normal range. Assessment. MRI of the pelvis and right leg revealed a right iliac hematoma, which causes a hemoglobin drop from 103 to 84 gram per liter. Now this clinical examination also shows soft tissue bleeding into the right thigh, and plasma aid factor was found to be lowest, that is 22 international unit per deciliter. All this above status of the patient places him suffering from hemophilia A disease. Because this hemophilia A disease, it is a genetic deficiency due to the clotting factor 8, and which results in increased bleeding, and if it is not treated or it remain poor prognosis, then condition will becomes very severe. So all the conditions which are described above, it suggests that the patient might suffering from the hemophilia A disease. Plain. Having established diagnosis of hemophilia A, the patient was given a 2-packed red cell transfusion to correct its anemia. Hemostasis was achieved using an activated prothrombin complex factor 8. The drug which we are using here is Hemofil M, 6000 units a day for 5 days because it is stable one. To eliminate the inhibitory autoantibody, the patient is given immunosuppressive therapy in high doses. As we are injecting the human or plasma derived products, so there is a chance of possibility of autoantibody production in the body. So in order to minimize immunosuppressive therapy is given. The drug and dose include prednisolone and cyclophosphamide. Prednisolone is given in the dose of 1 mg per kg, and cyclophosphamide is given 1000 mg once a day. The both drugs are given for 6 weeks. Previous medications of the patient should be continued for diabetes and hypertension. Note, now it should be noted that if patient experiences further episodes of bleeding over the coming months, then at this stage 2 days treatment with FEIBA 4000 units a day will be given. If the patient shows resistance to immunosuppressive therapy like cyclophosphamide, then cyclosporine will be used as a second line therapy. Patient is also obese, he is overweight, and he is also suffering from diabetes mellitus and also from the hypertension. So patient needs to reduce his weight because this might increase the chances of further cardiac disease. Conclusion. Hemophilia A is a rare hematological disorder and it can often go undetected. It is associated with significant morbidity and mortality due to occurrence of severe and life-threatening bleeding. Early detection is vital for improving outcome due to the rarity of this disorder, as this disorder is not occur very common. It is very rare disorder, so it is hard to guide and management of the bleeding disorder. However, in case of the severity of the disease, more research is required. These all are the references from which I prepared my case study. Thank you so much.